What's up, guys? It's Dr. Ryan Garner with Apothecary Wellness. Just because you're paying the lowest possible cost on a drug doesn't mean you're spending the least that you could. And that's demonstrated in the patient case that I have for you today. This patient is 49 years old, has a BMI of 33, so they are technically obese, has type 2 diabetes, and is on the max dose of metformin as well as insulin. Now, it's not uncommon for us to prescribe insulin when a patient's A1C in type 2 diabetes is greater than 9 or 10%. However, I try to avoid it at all costs. Insulin can lead to weight gain, increased cancer risk. It doesn't mobilize visceral fat, which is a primary driver in type 2 diabetes. It sometimes requires glucagon for hypoglycemia, and it also requires periodic blood glucose testing. Now, because they are fairly younger and have a shorter duration of diabetes, we'd still believe that there is some beta cell function in the pancreas, which is what is responsible for releasing insulin. Now, because of this patient's weight, we could certainly consider utilizing something like a GLP-1 and monitor that for 60 to 80 months or so, as well as something like pioglitazone. Now, pioglitazone increases the sensitivity to insulin in the body. And because of their age, we're not so worried about potential bone mineral density risks. So in an attempt to get this patient off of insulin, we could simultaneously reduce their BMI, minimize any kind of risk factors, and still look at possibly around $4,000 in savings a year.